Hello, thank you for joining me. I hope that by the end of this 30-minute presentation you will know why and how it's worth supporting your immune health. I need to disclaim that this presentation is not specifically related to COVID-19, rather it is an offering of research knowledge and tools to help you support your general immune health. And you will know that it's all good common sense too. So, your immune system is a network of cells, organs, proteins and antibodies that work to protect you against bacteria and viruses. Your body has a network of lymph vessels or tubes and lymph nodes. It collects fluid and waste material and other unwanted things like viruses and bacteria, all from the body's tissues. The lymph vessels are similar to veins in that they carry blood back to the heart, but instead of carrying blood, they carry a white watery fluid and white blood cells called lymph. You'll be familiar with a lymph gland being swollen in your neck when you have an infection. They're about pea-sized little glands and they filter all the harmful substances out of the lymph. The diagram shows some of the other glands and organs of the immune system: the spleen, the Peyer's patches, in the gut, the appendix, tonsils and adenoids. The bone marrow is where the white blood cells are made, and the spleen is also a filter and a storage organ. Your immune cells are always surveying for invaders. They learn how to recognize them, they activate a response, they deploy their weapons, they determine and discriminate the level of response needed, and thereby regulate the whole infection control response, including calming it down afterwards. And most of the time you have no idea this is happening. The cells of the immune system are all over the body, particularly patrolling your skin, eyes, ears, nose, mouth, gut and other mucous membranes, or any other point of potential infection entry like a cut. Imagine that the cells in this picture represent different fighting men in the military. They're all working tightly to protect us from infection. There's the intelligence listening to the enemy communications, royal signals communicating instructions to the fighting forces, the paras and the snipers taking out strategic enemy positions, the infantry following up, tanks pushing back the enemy, field guns, minesweepers, bullets and grenades. And it's no different in your immune system. Different cells, different functions, a highly coordinated attack and response. Neutrophils, they're our first responders, or the paras. They fire ammunition and toxic substances into the area to kill the target. Eosinophils, they release toxins like bullets and grenades. Basophils, they release chemical histamine, which dilates blood vessels to increase blood flow, and this gets more white blood cells into the battlefield or site of infection. The macrophages are like Pac-Man, gobbling everything up. They also shout very loudly to their colleagues for help, and they also activate the T and the B cells from the special forces. The dendritic cells have long tendrils that can reach between cells and around cells, and they gather information and intelligence. The natural killer cell, they kill virus-infected cells and anything else they don't recognize. It's real cell-to-cell combat with these guys. The T cells are like soldiers who search out and destroy targeted invaders. And the B cells make antibodies that lock on to a target, like a missile is locked on. They're specific to each target, so different targets will need different antibodies to kill them. And finally, there are cytokines and chemokines, which I haven't drawn because they would just look like dots. They're very tiny, and they're the chemical messenger molecules released by the white blood cells to communicate with each other. They increase inflammation. Too much of them causes a lot of collateral damage. You will find that 70% roughly of your body's immune systems are found in the gut. Let me talk you through this diagram which I drew. It's trying to show the differences between a healthy gut lining on the left and a damaged, inflamed gut lining on the right. We will start at the top and work down. You can see the arrow which shows the food moving along the gut tube. And in and amongst the food particles are bacteria, some of them are good, some of them are bad, viruses, chemicals, and all manner of foreign molecules floating along. Then you'll see a layer of protective mucus and some of our resident beneficial bacteria and a layer of rectangular shaped cells below those with wiggly top things. You can imagine this layer is acting just like your skin would, trying to stop unwanted substances getting into your body. Anything inside the gut tube is still technically outside of your body, with many defences between it and your bloodstream. It's only when food gets absorbed through, not in between, the intestinal cells that it can be considered inside our bodies. Probably the most important special force are your resident beneficial bacteria. Imagine them as being your allies in the fight against infection. They aren't actually our body's own cells, but they act on our behalf because we host them. The bacteria talk to your immune cells and are fundamental because they're the link between your immune health and your overall health. The broader the diversity of your beneficial bacteria, the better. A bit like a multicultural community, all tolerant of each other and working together. The layer of rectangular cells that are tightly packed together are like a human shields, like in a battlefield. And they are held together by cross-linking proteins called tight junctions. They have long, stretched-out villi or bristles like a brush, reaching into the gut tube to increase the surface area for nutrient absorption. And within the bristles and the protective layer of mucus live our resident bacteria. Now, on the right side, you can see that the tight junctions have been broken and the bacteria and the damaging bacterial fragments have sneaked through between the cells. Here is where your white blood cells recognise that the defences have been breached and mount an inflammatory attack. And that's what I want you to understand. I want you to understand that when you eat poor food and you choose the wrong habits in your life, this will continually damage the integrity of this delicate barrier. It becomes too permeable. Imagine tears in a muslin cloth, if you like. And if the tears don't get a chance to heal, then the battle that our immune cells have to fight is ongoing and it becomes chronic. And worse than that, some of the toxins and bacteria and the fragments of bacteria could get through the ranks and into our bloodstream, where the inflammation will follow them wherever they may go. And this is why functional medicine practitioners always focus on healing and sealing the gut to improve healthcare problems being driven by this process. In a healthy body, the immune system is silent. When it's working well, it quietly patrols and handles everything so you can carry on. However, if you do notice some mild symptoms like increased susceptibility to infection, too many coughs or colds, or too much mucus production, the feeling of always needing to clear your throat, then this can indicate that your immune system is overworking. Digestive symptoms like food intolerances, allergies and eczema, bloating, IBS and diarrhea, and of course, autoimmune conditions. Not surprisingly, your immune system ages as you age. Children are hardly bothered by their colds, while we may need a day or two off work, and our parents may need a week in bed. It's called immunosenescence. It's defined as the reduction in resistance to infection, poorer responses to vaccination, and higher cytokine levels, and also the development of age-related diseases. So for me, it's about minimising the negatives and increasing the positive to support healthy ageing. You want to avoid chronic stress, please don't underestimate the negative effects of chronic stress on your health. You want to avoid eating factory-made foods, sugary foods, gluten, white flour foods, unnecessary antibiotics and painkillers, being too sedentary and having too much abdominal fat, drinking too much alcohol, smoking, and a chronic lack of sleep. Studies have shown that every one of these factors can compromise our immune function. So let's go through each of these important influencing factors: the food we choose, the exercise we take, how we handle our stress, and how best to sleep. First, we'll be looking at how to make a healthy food plate, eating guidelines for longevity and health, and specific nutrients and foods for immune health. This is how to make a healthy meal. I'll summarise the written bullets and you can just look at the foods in each section. Number 1 and 2 together means fill half your plate with colourful vegetables and/or a piece of fruit. Number 3, choose some slow release, low glycemic carbohydrates like whole grains, but not wheat, quinoa, buckwheat, oats, millet and rice. If you want to lose weight, reduce the quantity of these or skip them altogether. Number 4, choose your healthy fat and have a small portion. Avocado, extra virgin olive oil, nuts, seeds and oily fish. Number 5, decide on your protein, be that animal or plant. Aim to fill a quarter of your plate, a palm or fist-sized portion, because adequate protein is key for making new cells, like immune cells. And number 6, think about what superfoods you want to include, the ones with special properties like antimicrobial herbs or probiotic foods, fibre for your microbiome, your good bacteria to feed off, and anti-inflammatory foods to lower your body's immune responses. I'll be giving you some superfoods for your immune system in a minute. Here are researched healthy eating guidelines. Minimise processed foods and avoid all refined carbohydrates and sugar. These are fizzy drinks and fruit juices, white flour products like cakes, biscuits, buns and bagels and dairy chocolate. Avoid alcohol, sugar in all its forms. Beware of barcodes and packaging and long ingredients lists and ingredients you can't pronounce. Avoid any food that trigger your sensitivity or intolerance or allergy. Dairy can increase mucus production for those with intolerances. Likewise, gluten for celiac sufferers and non-gluten sensitivity. Eat a rainbow of coloured vegetables and fruits. By rainbow I mean purple ones and red and orange and yellow and green and white or tan coloured vegetables. Choose raw or slightly cooked. They're full of fibre which feed your good bacteria, and they're full of plant compounds that are anti-inflammatory. Don't be scared of healthy fats. Enjoy your cold pressed oils, your organic butter, your avocado, your nuts and your seeds, your coconut products, your live yogurt, your olives, your extra virgin olive oil and your oily fish. They are very anti-inflammatory and your body needs them. Avoid snacking. Aim for 4 to 5 hours between your meals. Try intermittent fasting. Both these allow your gut to rest and make your cells hungry, if you like, for their next meal. This regulates your hormones, your mood and your energy. Drink 1 to 2 litres of filtered water or herbal teas a day. We don't need caffeine, we don't need fruit juices or frizzy drinks, we just like them or get used to drinking them. We only really need water. Here are some of the most important vitamins and minerals that your immune cells need. Vitamins A, Bs, C, D and E, and also the minerals zinc, iron, copper and selenium. Now I'll give you some foods that are high in these specific nutrients. Vitamin C, I always think citrus, so lemons, limes, oranges and grapefruit. Just keep your grapefruit away from medication. You'll know that applies to you because your doctor will have told you. Kiwi, peppers, Brussels sprouts, all of the berries you can think of. Tomatoes, cauliflower, sweet potatoes, kale and the other dark green vegetables with leaves like rocket and nettles and spinach, chard and watercress. If you want to supplement, 1,000 milligrams a day is fine. Try and make it in divided doses or in a time-released formulation at or with your meals. If you have an active infection, then you can increase your dose quite considerably up to 5,000 milligrams. But if this gives you loose stools, then just reduce your dose. Vitamin D is our sunshine vitamin. Try and expose as much as your skin as you can to the sunshine for 20 minutes a day. Don't let it burn you. Cod liver oil, sardines and other oily fish, liver, tuna, egg yolks and fortified foods give you your best sources of vitamin D. So vegetarians won't get any of these and therefore they're at greater risk of low vitamin D, which significantly impairs immune function. Most of us, and especially vegetarians, should check your levels with a finger prick blood test from MediChecks online before you supplement. And then that will guide you as to how much you need, roughly about 2,000 IUs a day or more. You want to check your levels after you've supplemented for a period of 3 or 6 months as well. Vitamin A is essential for our immune cells and system. It comes in 2 forms, retinol, which is active and readily available to the body, and that comes from animal foods like liver, oily fish, cod liver oil, tuna, dairy and eggs. And also beta-carotene. This is an inactive form from orange and green fruits and vegetables. Think of carrots and butternut squash and apricots and mangoes and cantaloupe melons. And for green foods, think of kale and rocket and spinach and chard and watercress and pak choi and avocado. Selenium is found in wheat germ, bran, tuna, onions, tomatoes and broccoli, all the nuts and seeds and mushrooms, but especially Brazil nuts. If you can eat 4 or 5 a day, that should give you all you need for that day. If you want to supplement, then 100 micrograms is about right. And finally, zinc. We find this in beef and lamb and pork and wheat germ, in pumpkin seeds, eggs and asparagus, shellfish and oysters, fennel, nuts and seeds. If you want to supplement, try and find a citrate form and about 20 milligrams a day. Here are my list of superfoods that I want you to look out for and buy if you want to support your immune system. Specialised mushrooms like shiitake, reishi and oyster. Prebiotic fibre from garlic, leeks, onions, asparagus, chicory and artichoke. Fermented foods like sauerkraut, live yogurt, kefir, kombucha and kimchi. These are all readily available now in the supermarkets. Anti-inflammatory herbs and spices, garlic, ginger, turmeric, rosemary and oregano. Please use them really liberally. Dark chocolate is high in magnesium. This is our relaxing mineral, helps us to relax. And anti-inflammatory polyphenols, those are just plant compounds. Anti-inflammatory fish oils, think of salmon, mackerel, sardines, trout and anchovies. Exercise. Exercise to the immune system is like the Goldilocks phenomenon. Too much is as bad for you as too little. We need to get it just right. And that means we've got to listen to our bodies. Exercise reduces the levels of the body's stress hormones, giving our immune system a chance to rest. Exercise burns off excess abdominal fat, which we know increases systemic inflammation. Exercise releases feel-good endorphin chemicals, which makes us much less likely to partake in less healthy habits. And exercise stimulates muscles to release anti-inflammatory cytokines. We all know sitting is too bad for your health, so try and break it up with a sprinkling of mini movements throughout the day. Little and often is good. By balanced exercise, I mean some cardiovascular, some resistance or body weight exercises, some stretching and balance exercises. The right kind of cardiovascular movement, like walking or running or swimming, will all help move your blood and your lymph around your body, cleaning everything as it goes. Strength training twice a week has been shown to reverse aging in muscles. It lowers your risk of diabetes. It improves brain function and reduces stress and anxiety and improves self-esteem. It reduces your risk of osteoporosis and improves joint flexibility and function. Hard or intense exercise can cause acute inflammation of muscle cells, and we feel this as a soreness the day after exercise. The pain or soreness is the inflammation, the immune activity that your body had to do to repair the damaged, overworked muscles. And that's okay, but it's the reason why it's important to give your body enough time for the soreness to go and the muscles to repair and adapt before you train hard again. Without sufficient recovery, you promote chronic inflammation. I'm making a short video of some simple yoga poses to help rib expansion and posture, and some breathing exercises to optimize lung expansion, relaxation, and carbon dioxide resilience. Stress. We have two main stress hormones, adrenaline and cortisol, and they are released in response to emotional or perceived stress, as well as obviously the physical stress. But our days in modern life are more preoccupied with emotional perceived stress, and it's called your fight or flight response. And even though these hormones are anti-inflammatory in the short term, in the long term, demand for them causes inflammation to rise. Chronic stress for months and years causes a resistance or desensitization to cortisol over time. It's like somebody who's constantly knocking on your door that you don't want to speak to, week after week, month after month, and year after year. At some point, you'll get eventually sick of it and just learn to ignore it. Over time, in the same way, we lose the ability to regulate inflammation, which then slowly creeps up. And it's exactly the same with insulin resistance and diabetes, but I haven't got time to go into that now. You may notice a worsening of your medical condition when you are under prolonged stress. You may notice increased tiredness or irritability. Ask a person with rheumatoid arthritis what stress does to their joints, or a diabetic what stress does to their blood sugar levels. Constantly elevated cortisol worsens the immune cell's communications. It slows wound healing. It reduces the number of white blood cells that your body will make, and it increases your risk of infection. It impairs digestion, therefore reducing your ability to absorb important nutrients. And of course, stress leads to unhealthy lifestyle choices, drinking and smoking, and lack of exercise. So it's a catch-22. Here are some ideas to help you handle your stress. Affirmations. These are short, powerful, positive statements of intention that you repeat regularly or as often as you possibly can. You're talking to your unconscious mind, programming in what you want for yourself. It has to be short, it has to be positive, and it has to be in the present tense. I am. So some examples are: I am calm. I am the boss of my thoughts. I choose to be happy. I am good enough. I am loved. reframing. How to interpret an event is really key. There's a wonderful saying that goes, if you can't change the world, then change the way you think about the world. When we reframe a negative situation into a positive one, it has powerful effects on our physiology. If you're struggling to reframe something negative in your day, then pause and ask yourself the why question. Ask yourself, why do I do my job? Or why do I do my primary role? And why does it matter? And eventually, if you keep asking it and keep answering it, you will find your positive reframe. You could also try seeing that event as if you were a neutral observer, because by being in the third person, you may see things in a more positive way, because that puts that crucial distance between you and what's going on in your life. Gratitude. Gratitude is the antidote to stress, and it's now been backed up by medical science. Try to find 5 minutes in your day to reflect on what you are grateful for. That might be a person you love, a pleasure or hobby you enjoy, or a promise of something good to look forward to and to feel grateful for the hope that it brings you. A morning routine. The 3 M's. This stands for mindfulness. Think of something positive for 10 seconds. Move. Do some gentle stretches for 10 minutes. And be mindful. Sit for 5 minutes and set your positive intentions for your day. It's your day, nobody else's. So make it how you want it. It's impossible to be grateful and stressed at the same time because they are opposite emotions. So the more you spend time being kind and grateful and calm and mindful and finding ways to make yourself happy and laugh and other people, the lower your immune responses will be. Please take some time to work out what you're going to commit to. Sleep is a time when your body heals and regenerates. People can live longer without food than they can without sleep. That's how fundamental to health it is. I've just this week listened to a webinar on sleep from Dr. Stanley, and he summarises his 35 years of research into sleep, saying that really good sleep boils down to 3 things. A quiet room, so you must make it a nice place to sleep. A relaxed body, do whatever it takes for you to be relaxed in your body. And a quiet mind, again, whatever works for you. If you're a poor sleeper, can you identify which one of those is relevant to you? Because that's what you need to work on. Let me just give you a few of his researched recommendations. Thank you, Dr. Stanley. Your bedroom should be dark, quiet and cool, and you should have a comfortable bed. The bedroom should be strongly associated with sleep. That means no TV or computer or work. It's essential to listen to your body and only go to bed when you're sleepy. If you haven't fallen asleep within about 30 minutes at the start of the night, get up and go back to bed when you feel sleepy. If you wake in the middle of the night or the early hours of the morning and you just can't fall asleep again, within about 20 minutes, do the same. If you're checking what time it is, then your eyes are open and they should be closed and you should be trying to sleep. And this will make you more likely to worry about not sleeping when you clock watch. Try to establish a regular time for going to bed and a regular time to wake up, even in the weekends, because this will help you get into a consistent routine and your hormones will become better regulated. It's easier said than done, but try not to worry about your sleep and don't try and force yourself to go to sleep. The harder you try, the more difficult it will become. Prepare yourself in a relaxed way before you go to bed. Spend at least 30 minutes winding down, however you like to do so. Try to sleep with a quiet mind and a relaxed body. Find something that calms both. It could be drinking herbal teas, doing some stretches, listening to music, or some deep breath work. Whatever works for you, find what works for you. And if you're still having difficulties, you might like to try Sleep Station. This is an online sleep training course over 6 or 8 weeks, I think, which can be prescribed by your doctor, or you can buy it yourself online. The other one is free and it's called sleepful.me, and again, it's an online self-guided course. You can also try my breathing techniques and my progressive relaxation technique too, which I'll put on a video for you. Every human being is the author of their health and disease, said the Buddha. So thank you so much for listening. I really hope I've shared something valuable to you and inspired you to be the author of your health. Thank you. Thank you.